Welcome to Avikna Learning Academy. Today we are going to show you how to write an OET referral letter for the OET Medicine students. Okay. You will be given a case sheet for the referral letter, and you as a doctor will have to write a letter to another doctor. That's what the main thing is about. This task will be, the time given for you for this task will be 40 minutes. So what you can do to organize yourself is the first 10 minutes you can take to pick out all the relevant points from the case note. And the next 25 minutes, around 20 to 25 minutes, you take to organize all your points and put it into your letter format. The last 5 minutes, you can just wrap it up by checking for look out for any errors, proofread your letter, see to it that everything is in a perfect condition. And also count the number of words. The words that are allotted for you are 180 to 200 words. That's what your letter should consist of, just 180 to 200 words. If it's beyond 200 words, it will not be graded by the OET examination centers. So stick to your number of words. Though your case note will be in a note format, your letter should never be in a note format. You should write it in a letter format, that is with the to address, introduction, body of the letter, conclusion, and such things. Okay, let's have a look at the case notes. Okay, whatever you see in red has been highlighted, and these are the points that I feel are important. These are your relevant points that I have picked out from the case notes. Okay, the patient name or today's date is 16/2/2009. Though you are writing the exam in 2018, please see to it that you write the date that is given in the case note and not the date that you're writing the exam in. So here in your case notes, it's given as 16/2/09. Keep that date in your letter. The patient name is Miss Kathy Jones. She is a 25-year-old single woman. In her history, we have that she is on progesterone only pill for contraception, no previous pregnancies. In the subjective history, she complains of lower abdominal pain since the evening before, worse in the right iliac fossa. Unsure of last menstrual period, has had irregular bleeding since starting of her POP, that is since she started her contraceptive pills around 2 months ago. She also has a new partner for the past 2 months. Okay, in the objective portion, our important points are mild right iliac fossa tenderness, no rebound or guarding. Vaginal examination, quite tender in right fornix. Okay, in the assessment, we have the important point as ask her to return in the morning for blood test and assessment. So you can understand it may be a 2-day schedule, and the first day your patient has come and you've done few examinations and you are asking the patient to come another day for a reassessment. So your letter will be having a first day information and the second day information. Okay. On the second day, let's see what's happening on 16/2/09. The subjective symptoms are that the pain has worsened overnight. Patient has slight vaginal bleeding, and the objective symptoms are very tender in the right iliac fossa with guarding and rebound tenderness. On vaginal examination, has cervical excitation and markedly tender in the right fornix. Pregnancy test result is positive and urine dipstick is clear. Assessment or your doctor's assessment is that you are suspecting an ectopic pregnancy. Now you are writing a referral letter to another doctor asking for an opinion or asking whatever assessment is there is something you have suspected. You want the other doctor to confirm your diagnosis and run through some tests or something if required. Okay, your task is that you are the GP, that's a general practitioner, Dr. Sally Brown, and you have to write a referral letter to the gynecology registrar at the Mater Hospital in South Brisbane. You also want to be informed of what the other doctor has diagnosed or what are the tests that have been done. whatever it is. You just want to be kept update about the results of what the other doctor finds out of any other findings. Okay, as I told you that the time given to is just 40 minutes, and I've told you how to organize your time. The letter should also consist of only 180 to 200 words. So let's see how we can write this letter. I will show you a sample letter, how it can be written to get a good score. Okay. Coming to the letter, you start with the to address, that is the address to whom you are addressing this letter to. We are addressing this letter to the gynecology registrar at the A&E department, that's your accident and emergency department, at Meta Hospital in South Brisbane. Then you come to the greetings and salutations, that is dear doctor, put a comma. Then the reference is Kathy Jones, date of birth is 1/12/83. Write the patient's name and the date of birth together in the same line. This is very important. We can find out the patient's age with the date. Okay, you thank in the first paragraph, you give just an introduction telling as to what you suspect from this case or what is the outcome of your diagnosis. That's, you say, thank you for seeing this 25-year-old woman who I suspect has an ectopic pregnancy. Okay, the next two paragraphs, you're talking about the findings that you found on 15th and on 16th. So we start off with, this is her first pregnancy. She presented to the surgery yesterday evening with vague lower abdominal pain. She started the progesterone-only pill for contraception 2 months ago when she started a new relationship and has had some irregular bleeding since then. Therefore, she is unsure of her exact last menstrual period. Yesterday, she was mildly tender only and her observations were normal. So this is the our findings for the first day. We have put the commas and full stops wherever it's appropriate. We have used the right tense. So these are some of the things you have to keep in mind when you write a letter. Use your capitals wherever required. Put up your commas wherever you want to pause or you want to continue. You have two ideas to be written in one sentence. Break it up with a comma and put a full stop at the end of the sentences. Okay. In the next paragraph, we are talking about the next day. That is, however, on review this morning, her pain had worsened overnight. She is very tender in the right iliac fossa with rebound and guarding. And on vaginal examination, there is cervical excitation and marked tenderness in the right fornix. Her pregnancy test is positive. Okay, this is the first 2 days examination findings. Last, we are concluding our letter with what we suspected. I'm concerned that she may have an ectopic pregnancy. So here we are just suspecting, that's why we use the word she may have. And would appreciate your urgent assessment. Okay, please keep me informed of the outcome. So you have told the referral doctor what you're suspecting of and what you expect from the other doctor. Okay, you end your letter with yours sincerely, Dr. Sally Brown, GP. Okay, you can use some of the abbreviations that are usually used on medical terms are allowed even in the letter. Like general practitioner is GP, or if you want to write about blood pressure, you can write BP. Okay, so I hope I've been helpful, or we have been of some help to write an OET referral letter for our OET medicine students. We also have more information on our website, so please log on to www.avitnalearning.com. Please read our blogs. There is tons and tons of information for the students who are preparing for their exams. So please go through our blogs also. Until next time, thank you.